My name is Michael from Naturopathic Specialists. It is April 6th, and I'm here with Dr. Mia Darling. We wanted to make sure that with all the things going on around COVID-19 and social isolation and just all that stress and anxiety, that you have a good place to turn to get some answers from a face that you can recognize. So today, I wanted to just ask Dr. Darling a few questions that were presented to Dr. Christ at the town hall with the governor on April 2nd. And see if we can get some answers just repeated in case we weren't able to get that. So the first question for you, Dr. Darling, what should someone do right now if symptoms start developing?
Good morning, Michael, and thank you for hosting this. I think the hard part right now is there are a lot of unknowns for everybody and a lot of confusion about should we test, should we not test, what should we do if symptoms start to develop. So what's being recommended currently, because of the high numbers and the high numbers of possible infection and people that need to be tested and the low number of tests available and supplies for those tests available, they're recommending that we stay home if we start to feel symptoms and monitor ourselves very closely. However, if symptoms start to increase, and that specifically seems to revolve around breathing at this moment. So if you start to feel any tightness in your chest or difficulty breathing or pain in your chest, this is the time when we need to seek care. But I do recommend that you have a plan in place before you get to this point. So some of the resources that are currently available in our area is a hotline. If you dial 211, you will be connected with somebody who could answer some of those questions for you. What is the screening procedure? Who should I reach out to when I don't feel well? Can I be screened over the phone? Do I need to go to the hospital? At what point do I go to the hospital? And do I need to call ahead and tell people that I'm on my way? Another available phone number for people in our area is the Department of Health Services. And that number is 844-542-8201. And again, that's manned by humans who can answer your questions and tell you when and where testing will be available. Mayo is offering some, and so is Banner. And if you Google online, where can I get tested, some of those resources and numbers will pop up as well.
Excellent. I'm glad you gave those resources because we don't have the tests at Naturopathic Specialists, correct?
Correct, we do not. We are not a facility that's offering patients to come in if they're experiencing symptoms. This is because one of the things that we do is we have a high-risk population of a lot of oncology patients that we treat here, and we're very careful at this point. We're only allowing one patient to come in at a time. We're keeping that strict 6-foot distancing that's being recommended. Everybody's temperature is taken before they're allowed to enter the clinic, and they're screened with a bunch of questions too about symptoms they may be experiencing. And then both the doctor and the patient wear a mask at all times when they're in the clinic. So unfortunately, we don't have the test because of the low numbers that are available, but also we're trying to keep our patients very safe and be here as much as possible for those patients that we have and we can help.
Thank you. And you mentioned the testing aspect. That's something that I know a lot of people want to do. If it's the worst time of year almost for this because of allergy season, so you have a runny nose or something like that, you want to know, do I have this? Am I going to give it to my family? How aggressively should people be seeking these tests? Or, I'm sorry, go ahead.
At this point, they're recommending, because of the low numbers, that we don't test unless we get to the point where those people have to go into the hospitals. And that isn't necessarily the best answer. I know the more we know who's carrying this virus and the more we know who has actually been infected with it, the better we can isolate and prevent those we love and care about in our communities from spreading it as well. But we're doing the best that we can. So we have to weigh, is it worth you going out to get tested and potentially exposing yourself to more sources of the virus? Or should we wait and should we be carefully monitoring ourselves at home? That's what some of those hotlines are there to help us with too, because it's a hard decision. But certainly if you're feeling trouble with breathing and pain in the chest, don't wait. Those things can change very rapidly. And if they do change, some of the ERs are reporting that they can be talking to someone and within the next few minutes, they need to be ventilated. So we need to make sure that if you're experiencing any of those symptoms, again, you've got that plan in place and you're ready to go.
Good. And if the person's experiencing just mild symptoms, if they do get the test and they find out they do have COVID-19, would the treatment change at all?
No, the treatment doesn't change. It's just, I think you have to consider if you have any symptoms right now, treat yourself as if you have the virus so you're not spreading it to those around you. The facts are 80% of people will not need to be hospitalized and not need that acute care. Those are the people that can stay out of the hospital systems and leave those places open for those who really do need the care. But again, make sure you're safe, make sure you're monitoring your symptoms, and make sure you have a plan in place.
And then there's a good difference between quarantine and self-isolation, right? The self-isolation, even in a house where you're the only one that's sick, you can stay separate as much as possible from the other family members in the house to avoid maybe giving them something. If you think you have it, if you don't, that's just a good way to be cautious, right?
It is, and we all need to be doing that for each other anyway, because they're saying 25 to 50% of people who are infected with this virus may be spreading it to others, but not showing any symptoms themselves. So
Mhm.
that's why we have to be careful, and that's where the masks come in and the hand washing comes in, and just physically distancing ourselves from others, but making sure we're still connected either through this type of resource or being able to go for a walk and have our headphones in and talk to a friend, or enjoying a cup of tea over Facebook or Zoom or whatever FaceTime resource you have available. But we want to stay connected with those we care about. That's really important. But the physical distancing, again, you may not even know you have this virus and you could be spreading it to others.
Yeah, for sure. So once someone has COVID-19 and recovers from the disease, do we know about how long that person remains contagious?
We're not certain. That's the other hard part. So, a current recommendation is once you're fever free for 72 hours, the assumption is you may not be spreading it anymore. But really, some of the top directors in this country, medical directors, are recommending you need to be tested and you need to show 2 negative tests for the virus 24 hours apart to know that you're absolutely not shedding the virus.
Hmm. So with regard to that, and you say shedding the virus or maybe putting the virus down where someone else can contract it, how long does the virus stay on certain surfaces, on clothing, money, cell phones, or all of those things that people might come in contact with?
Again, it's unknown. So the best course of action is assume that those virus particles can stay on those surfaces for up to 3 to 5 days. I mean, that's the highest recommendation amount. Now, if something's undisturbed and dark and there's no cleaning solutions involved or anything like that, we're going with days at this point, is what they're saying. Again, that could change. But what you really need to do is make sure you're washing your hands before you touch surfaces. If you're bringing groceries into the home, you're wiping those groceries down. And the things that you can use is a mild bleach cleaning solution, or you could also use a 70% or higher alcohol-based solution to make sure you're destroying the virus so that it can't, continue to cause contagion. So we're really recommending that before you touch that cell phone, make sure that your hands are clean, and then make sure you wash your cell phones. I spray mine with a 70% alcohol solution, or I wipe it down with the alcohol pad. Geez, almost every hour while I'm in the office. And I'm really making sure that I'm gloved with patients. And then as soon as I unglove, I wash my hands before I touch any of those surfaces again. So really, just assume that those particles are able to hang out there until they can be cleaned. And when you bring things into the house, make sure you wipe down the surfaces you put them on and dispose of all the wrappings and get them out of your home.
That's a good way to make sure we're trying to do everything we can to be safe. I know in Phoenix, there's this mindset a little bit of thinking that the heat almost kills us every year. What's it going to do to the virus? Is there any kind of answer for that?
Yeah, outdoors, it's going to do great things. It's going to wipe the virus out, but you're still dealing with the air conditioned, nice and cool insides that we have all over here. And part of the reason why we see the flu numbers and drop and things like that is because people can get outside more. And the sun and the heat do kill the virus and stop it from lingering on surfaces outside, but that's not going to affect what's going on inside. So we really still have to be diligent and make sure we're cleaning our indoor surfaces and not just think that it's going to be a problem that immediately goes away once the temperatures get higher here.
So good reminders not to forget the basics, washing hands, using hand sanitizer, using proper hygiene.
Exactly.
So one last question about these things from the town hall. Those who have recovered from COVID-19, do we know if after they get it and recover, they're basically immune to it? Or can they get it
Yeah.
again?
Again, there's confusion around that. So currently we think that there is some immunity being offered if we're carrying the antibodies that we have made in response to being exposed to the virus. And they have tests now to see if you've been exposed in the past or are currently exposed, IgG versus IgM. Those are the rapid tests that are coming out now. We'll see how quickly they get into circulation and available for the general public. We think it does confer some sort of immunity, but we don't know how long that immunity lasts. And we also don't know if the virus is capable of mutating into a form that would no longer offer immunity for the virus you've been exposed to. So we think it is helpful, and we think that there is some immunity conveyed once you've had it, but don't take that for granted. Still continue to do the things that we're recommending and keep yourself safe.
Mm-hmm. And the best recourse is generally, like they have been saying, to try and flatten the curve so that if someone develops bad symptoms, they're able to be handled in a way that can really help save their life, correct?
Correct. The more we stay inside and the more we stop the spread of the virus currently, the better the hospitals will be able to handle the numbers of people that are coming in and showing symptoms.
Well, thank you for answering those questions. I think that's a lot of the main ones that people have just about COVID-19 itself. But what about for our own mental well-being and our health? Is there anything that you do? You're a doctor, you're a parent. How do you de-stress or manage at the end of the day?
I try to make sure that I'm informed, but I don't sit there and stare at the news all day long. I try to make sure that I'm watching some funny movies or some things that I enjoy. I spend some time with my kids. We started Disney Plus last night. That
Mhm.
was a nice way to kind of take the night off from things. We also make sure that we get out. We've been walking at least 4 miles every day in the evenings when it gets a little cooler, and staying away from areas where other people are walking. We tend to go through neighborhoods and keep our distance and cross the street if there's other families out walking. And I've been cooking a little bit more, just taking a little more downtime, not rushing around as much, no errands to run, staying indoors. So bringing back some of those hobbies that you enjoy, making sure you have good, fresh food, nice water, staying hydrated, keeping yourself healthy in the downtime, exercise, fresh air, sun, good food, and a little bit of laughter, I think are the basic recipe that most of us can follow, and then take it from there, whatever makes your heart happy.
Well, excellent. I can hear the clinic getting a little bit busy back there, so I want to say goodbye to you, but want to remind everyone that if you've enjoyed this, we're going to be trying to do this fairly consistently, just so we can have some basis for answering any questions that come up. So if you have a question, send a message on Facebook, send a message on Instagram, on YouTube. Those are our channels that we're using for social media like this. Follow us, like us, and you'll be informed whenever we post a new video. We have some planned. Tomorrow, Dr. Rubin, and the day after, Dr. Coates. And then I think after that, it's you again, Dr. Darling.
I
So
look forward to it.
that'll be some of your encouragement for the day, getting to see this face again.
Perfect.
Thanks so much, Dr. Darling. We'll talk to you later.
Thanks, Michael. Have a great day.